What's up, ladies? Welcome to the health class she deserves. It's your host, Autumn Peone, and it's March. Happy Endometriosis Awareness Month. I haven't done a solo cast in a while, and I haven't really given too many updates since my surgery and the diagnosis and all of that. So that's kind of what I wanted to do today. And I also want to then bust some myths around endometriosis. I have some exciting guests coming up in a couple of weeks, for March, and then even into April, probably, because this is such an important topic and it's obviously very near and dear to my heart. And yeah, so we're really going to be diving into endometriosis for the next couple of weeks. So I do have a few episodes back from like July, probably July, August, right after I got my surgery, with some updates and getting the diagnosis and all of that. And I dive into that. So if you're interested in kind of the origins there, definitely go listen to those episodes from a few months ago. So I had my surgery on June 24th. It's now March. And so it's, God. So we're coming up on 8 months almost since my laparoscopic excision, where I was diagnosed with stage 1 endometriosis in my right pelvic sidewall, the cul-de-sac, my uterosacral ligament. And basically, just to summarize, right after surgery, I did have some relief within the first month, but then it kind of bounced back and forth between each cycle of like if it was really bad or not. I also, this makes sense now, but typically when I ovulate on my right side, one, I can feel it, so I know it's my right side, and my symptoms flare so much more during ovulation on the right side. And then I also, menstruation would kind of be back and forth with like better than before surgery, and then like the same the next month, and then better, and then the same, and then back and forth like that. And I think that also correlated a lot with which side I'm ovulating from. I actually can't with how bad the lighting is. I don't think I'll be posting this on YouTube. So anyway, after surgery, I had a mix of feelings. I mean, one, it's like you finally get the diagnosis. You're like, thank God I'm not insane. There is something like actually physically wrong causing all of this pain, like I've been saying the whole time. But then also you're like reckoning with a lifelong diagnosis, a disease that has no cure. You're chronically ill. And I always thought of myself as a very like healthy, health conscious person. I eat a high fiber, high protein diet. I, get my fruits and vegetables in. I drink a crazy amount of water. I weight lift. Like I've always thought of myself as a fairly healthy person. And this has really been the only thing with my health that's been an issue. Yeah, there's a really big like mental component kind of reckoning with that diagnosis, while also being so grateful that I was able to get the diagnosis in the first place. So if you want to hear more of that like post-surgery when it was fresh on my mind, go listen to that episode from July. But right now, there have been improvements. There have also been not improvements. It's been an interesting journey, the past 8 months. Like I said, it was kind of yo-yoing back and forth. I did throw up a couple times since my surgery on day 1 of my cycle. Day 1 is always like the highest pain day for me, always has been. I'll be in an extreme amount of pain. Like my core can't physically hold up my body if I stand for any length of time. And by that, I mean 30 to 45 seconds. I am like collapsing. Like I can't hold myself up straight. I'll be bent over. And then the nausea is the other symptom that is really, really intense on that first day. And so between the pain and the nausea, I'll be vomiting and kind of unable to move very much, writhing in pain. And so that was always day 1 for me. Day 2 wasn't great. There was still like pain and stuff, but just compared to the intensity on that first day, it was always bearable. I could typically like go to school or work on the other days of my cycle, but that first day was always like the roughest, like would keep me incapacitated. And it got really as I got older, it got worse, even though I was learning about my cycle and trying to balance my hormones. And I noticed all these improvements with other things. There was just this one thing, the pain. that was getting more and more intense. And then these other symptoms that I realized were linked to endometriosis even before I got the diagnosis was like my ovulation symptoms and all of these things. And the pain again from ovulation is nowhere near the pain that I get from menstruation. But for some women with endometriosis, it's opposite. Their ovulation pain is like way worse. Some women just have pain throughout the entire cycle. Like it's very different for everybody. And I do want to make that clear because one of the myths that we're going to bust later is that it's just like a bad period. It's a period disease. For a lot of us, it does cause a pretty intense, unbearable period, but that's not what it is. It's just a symptom, like anything else. It's just a symptom. But it's not a period disease. It doesn't actually have anything to do with the womb, but we'll get to that. So anyway, I just want to make that clear that because my worst symptoms, my worst experiences are always on like day one of my cycle when menstruation starts, that doesn't mean that is endometriosis. That's just the most disruptive effect it has on my life. But again, every woman with endometriosis is different. And I know plenty of women with endo whose like periods don't really bother them that much, or like they're not incapacitated by it at least. So yeah, just making that clear as I continue explaining here. But the past couple months, I have not been like vomiting the way that I used to, so that's good. I still get like intensely nauseous, and that sucks. And I feel like I come close to throwing up. Like I'll be running to the bathroom, like I'm gonna vomit. But I haven't over the past couple. I think the last month that I threw up was like 4 or 5 months ago. So that's pretty good. And I think that the gluten-free thing, I talked about it on here a little bit. I think around that time, but I did start reducing my gluten intake pretty significantly leading up to surgery. And then like after surgery was like, okay, completely gluten-free. Um, it's not an allergy, but it's one of the main things linked to inflammation. And when women with endometriosis cut out these certain things, it makes a big difference. And so it's gluten, dairy, alcohol, caffeine. I already don't really drink that much alcohol. I don't never drink. It's like maybe a couple times a month, if that. Caffeine, no, thank you. I don't feel like giving up caffeine. And I actually have tried that out before and I didn't notice any like extreme difference. Dairy, I think, well, okay, gluten, then I decided was probably not going to be easy, but like one of the easier things for me to cut out. There are a lot of gluten-free options for most things. And I was like, yeah, I'm going to give this a shot. And so in doing that, and I have had gluten kind of like small amounts, either through cross-contamination or just like accidentally a couple times since I went gluten-free, and did not notice any like crazy differences when I had gluten. And typically when you have gluten intolerance, it's obvious. Like you cut out gluten and like poof, you feel like the brain fog is gone and digestive issues are gone and your skin clears up. I wasn't noticing anything that extreme. The main difference that I did notice was that I was throwing up less often from the nausea and the cramps. When I started reducing gluten, it was like the first time in like a year that I hadn't thrown up, and I was like, I'm still in a lot of pain right now, but it's not like so intense that I'm vomiting, and so I feel like that's an improvement. And as I continued doing it, since I cut out gluten, I've only thrown up a couple of months. I think the main thing that I've kind of learned from cutting out gluten, though, is that I do think dairy is probably a much bigger trigger for me. Since I have cut out the gluten, when I do have large amounts of dairy, or not even like particularly like large amounts, just a normal amount, I notice that I'm definitely flaring. And it definitely causes some digestive upset and some pain, depending on where I'm at in my cycle. It just causes a lot of inflammation that either makes the ovulation or the menstruation symptoms worse. Dairy's very, very difficult for me to cut. I mean, I don't eat like an insane amount of dairy, but like I've been trying to limit cheese, other than goat cheese, because my nutritionist boss says that goat cheese is like less inflammatory than dairy products that come from cows. So if I'm like really like have a hankering for cheese, I'll use goat cheese instead. Other than that, butter is like pretty impossible for me to avoid, especially when I'm working at the cafe on the weekends. There's butter in all the pans, everything. I also love gluten-free toast. I've gotten into sourdough, and I can't eat bread without butter. So we're working on dairy. But I do think that those two things have definitely been helping me since the surgery. When it comes to the surgery itself, the internal healing can take about 6 to 12 months. So I'll probably be giving it a few more months to truly assess. But I do think overall, while some months are still intense and painful, I do think that the overall level of pain has reduced since the surgery and since these dietary changes and since pelvic floor physical therapy, which I'll get to next. I think just a combination, this holistic approach definitely has reduced my overall pain. There are still days where I'm incapacitated from it. Like I said, day one and this past month, day two, was actually worse than day one. So things are altering, things are changing. I think I need to give my body some more time to fully adjust. It's really hard to make a call at this point. But overall, like I said, I think overall pain has reduced. Ovulation has gotten a little worse for me, I believe, since the surgery. Not like overly intensely. I think that there's some like nerve pain. Like I said, when I'm ovulating from the right side specifically, when I ovulate from the left side, it's not so bad. This past month wasn't so bad. When I ovulate from the right side, I will feel the middle schmerz or whatever they call it. I'll feel the egg drop. I will feel like leading up to it and more so right after because ovulation is a little bit of a violent process. We're discovering. But yeah, afterwards, it's a soreness. My right ovary sometimes will just feel like a jumping bean. I'm not really sure how else to describe it. It's nothing like major. It's not disrupting my life. If I'm not focused on it, I don't even realize it. It's really just kind of like if I scan my body, then I'm like, oh, I feel like my ovary is trying to escape. And then right around ovulation, it will get a little more painful, a little more like sharp and stabby. Um, Again, it'll just kind of be moments that like stop me in my tracks where I'm like, oh, whoa, what's going on there? And then I just continue with my life. And then the sciatica pain, particularly on my right side. Oh my God. The sciatica pain sometimes does like stop me in my tracks. And this all got pretty significantly worse after surgery. But I do think that there's a lot of internal healing still going on there. And so when I did ovulate, it just was really like there was inflammation there from the surgery, from actually the physical act of cutting the disease out. That's obviously going to cause some inflammation as that's healing. And then the inflammation from ovulation and the high estrogen and all that, I think was just kind of a perfect storm for a few months after surgery where my right side ovulation particularly was just intense and definitely got worse. It has been getting better though. And since I passed that like 6-month mark, it's been getting less each month, that ovulation pain. So hopefully that's improving. And that was just really a byproduct of uh, the scarring from actually cutting the disease out. So I do think that's improving. When I went back to my specialist for my 6-month follow-up, she did prescribe me with more gabapentin for like the nerve pain, which I really try not to take. I've heard that there's links to like dementia. I haven't looked into that very much. I don't take it very often, only if I really have to. And it also makes you really tired. Um, and then cyclobenzaprine is a muscle relaxer. And I'm actually really fucking pissed that no other doctor ever thought to prescribe this to me when I was younger, even before the diagnosis. Like I was telling them that I was vomiting, unable to stand up, writhing in pain, sobbing. it was completely disrupting my life. And the only prescription I was ever offered was naproxen. And I was like, this isn't doing I've told you that I've tried NSAIDs. I've overdosed on ibuprofen. Um, and it doesn't touch it. Like, I need something different. I need something working on a different mechanism. And I didn't really know any better. I didn't know that muscle relaxers could really be an option. So when my specialist was like, okay, let's try muscle relaxer, I was like, okay, I'm down for that. Um, I also really don't like relying on pharmaceuticals if I don't have to. But if I only have to take like a couple a month and it allows me to live my life, I will. So this past month, I did take the cyclobenzaprine before work, um, and my normal supplementation and stuff. And it really helped. And day one, I made it through the day. Like, I worked on day one and like at the cafe. So I was on my feet all day and I didn't feel great. I wasn't having like the time of my life or anything. I desperately wanted to go home and my back hurt really bad. I'll say that. But I made it through the day, which I never, like literally never since the day I started cycling when I was 13 years old, could not have done that. Um, so that was like a win for me. But then the next day, day two, I went in and I was fine in the morning. I was like, I think I might be fine. Like, I don't even want to take my med other than my supplements. I was like, I don't want to take the cyclobenzaprine yet. Because it does make me tired. So I was like, I don't really see a point in taking it yet. I'm not really in pain. Um, I just feel a teensy bit nauseous, but whatever. By the middle of the day, after a few hours there, between the running back and forth and all of the smells in a cafe, I was so nauseous. I was so nauseous and the pain was starting up again. And as soon as I felt the pain starting up again, I took the cyclobenzaprine and it put it at bay for a couple more hours. And then I was like, oh my God, like I just kept disappearing to the bathroom and I felt really bad. But I thought I was going to vomit and I needed to sit. Like, my core could not hold me up any longer. I was like, I need to sit. And every time I would like sit for a few minutes and then I'd be like, okay, I'm good. And I would stand up and I'd be able to run around for like 10 more minutes and I'd be like, okay, no, I need to sit again. And it was just like cycling. And then eventually, the manager pulled me aside. She was like, do you just want to go home? I was like, I feel bad. It's really busy. Like, I've pushed through this far. Like, you push through. She was like, yeah, but it's not really helping. I think that it probably would just be easier if you just went home. And I was like, okay, sounds good. So that was a little bit of a bummer from, being able to work the full day on day one and being like, wow, that was amazing. And then only making it half of the way through day two. But you know what? It's a major improvement from the past either way. Major improvement. So I'll take it for now. I think hopefully moving forward, I also will, that will continue to get better too as the internal scarring continues to heal and all of that. The other thing I wanted to touch on that I've been doing consistently since my surgery, well, not since my surgery, it was actually a few months after my surgery because I had a whole like health insurance debacle. But I guess I started in like October, maybe November, October. I think I started in October. Pelvic floor physical therapy. And this, if you get surgery and your specialist doesn't refer you to pelvic floor physical therapy, that's kind of crazy to me. Like, you need a pelvic floor physical therapy referral. Even if you just suspect endo, haven't had the surgery, or if you don't suspect endo at all, pelvic floor physical therapy, I think every woman needs to be in, regardless of, family plans, if they've given birth, if they have endo, if they've had surgery, whatever. I think it's so useful for everyone. And for me, I think I've talked about this on the pod before, like a long time ago, but I'm lopsided. I don't remember what the name of the bone is, but like in my shin, like the one bone is 6 millimeters, whatever makes more sense there, centimeters or millimeters. I feel like centimeters sounds like a lot. I want to say 7 millimeters. Anyway, my left leg's longer than the other. Um, and even just like looking at it, like I always walked kind of funny. Like, my mom had to like basically force me to walk with my feet pointed straight instead of in towards each other when I was like a toddler. Um, I remember walking to the bus stop in kindergarten and her being like, "Point your feet straight." And I'd be like, "Oh my God, it's so annoying." And she was like, "You're gonna thank me one day." Um, and I mean, she was right. Thank you. I'm glad I don't walk funny. But anyway, I have these structural issues. And if you just like look at me, if I were to just stand up straight on my 2 feet, you can tell if you're paying attention. You can tell my left shoulder is a little bit higher. And it just causes this like disruption in my body that's always been an issue. And then when I got into weightlifting, there were like just a couple things where I was like, okay, I know the correct form and I'm like doing the correct form, but something doesn't feel right. It was almost as if my body didn't like contort in certain ways that other people said. It just looked funky when I did it. And it was something I was like insecure about. I've always been like tall and lanky and awkward. And so, um, yeah, there's like an actual structural issue to that. And pelvic floor physical therapy has been helping strengthen, well, like, improve that coordination between the two sides and then, release so much tension. And because everything in your pelvic floor is like the fascia is connected to everything. It's crazy. And there's this one when she's doing the internal tension release, there's this one spot. And since I've been going, it's gotten so much better. But when I first started going, it was like the deeper muscles on the right side, always the right side for me, uh, and the deeper muscles in my pelvic floor, and she would be like pressing down to release the tension there. And I would feel it all the way up into my jaw. Like my jaw would get really, really tight and tense. Like I couldn't relax it. I tried so hard to like relax it and it would just be whenever she was pressing on it would be so tense. And then I started to get like tremors like through it was kind of like chills, and I did get cold, but it was only for this part of like the exam. Like, and this was always the last point that she would massage. So I'd already been like laying on the table with my pants off for a solid 10-15 minutes at that point and wasn't cold at all. And then as soon as she would get to this point, I would get like chills and I would have these tremors through my body in like my arms and my chest and my jaw. I would start to chatter like like so uncontrollable. Like I was like embarrassed. I'm like twitching on the table. I'm like, oh my God, like what's going on? But the fascia is so connected. Like it is so connected. And chances are there's some like emotion or trauma that was being stored there that we've been releasing through these appointments. And so just at my last appointment last week, she was massaging that point and it's still like it's vaguely there. Like I still feel my jaw get a little bit tight, but I'm not like shaking and shivering like I was before. There's definitely been so much like release and improvement there. And just more stability, like just really working and strengthening the supporting muscles from my feet all the way up through my pelvis and my core, to just help me overall. I'm hoping that this also helps a lot with like my neck tension and stuff, but I really need to get a neck pillow, because I know that the way I'm sleeping is really fucking with my neck. But anyway, pelvic floor physical therapy. 10 out of 10 recommend. It's just, especially if you have pain from endometriosis or anything else, it's really useful. Because it's also helping with the back pain that I get. And like I was talking about the sciatica pain, like these things are also really being improved as I'm strengthening these different core muscles and everything. So I'm excited for how that's going. And yeah, I can't wait to see like how it continues. But um the other really useful thing I'll say about that is I do have this one scar from the surgery that would be like really itchy and like tingly. It's just been angry since the day I got it. One of the stitches, because the stitches dissolved, so they didn't need to be like removed or anything. But one of them, I remember like a week after surgery, like popped a little bit on the side, and then that one has just been like so much angrier than the other two or three. So yeah, it bothers me and it still bothers me sometimes, but since her, like, massaging it out with the pelvic floor physical therapy, she's, like, massaged it all out and everything, and it's had some major improvements for that too. So, that's where I'm at. I wanna move into a little bit about what endometriosis is because it's come to my attention. I mean, I knew there were a lot of misconceptions around it, but, recently my TikTok has been doing very well. I did reach 10K on TikTok, which is very exciting for me. Um, I had a few videos get a few 100,000 views, and so there's just a lot of engagement on them and a lot more people outside of my typical niche that saw a few of these things. And the comments, there were a lot of people that were like, "Oh, I didn't even realize what endometriosis was." For example, the one video, I'm like pointing to different places endometriosis has been found in the body. If you didn't know, endometriosis has been found on every major organ. Um, it's been found in the skin. It's been found in the brain, the lungs, the heart, and then all the pelvic organs that we like more often associate with it, like the bladder, the bowels, the uterus, the ovaries, the pelvic sidewall, the like all of those things. It's also been found like in the legs, in the belly button, um, and the eyes and the nose, in the mouth. Like it has been found everywhere. And the lymphatic system, that one's crazy to me. Um, so it's truly been found everywhere. And a lot of people were commenting on that video being like, okay, I don't think I know what endometriosis is. Or like, I thought I knew what it was, but this is making me realize that I must have no idea. Or like, I have endometriosis and I did not know this. And it's like, yeah, because most doctors, literally most doctors, literal MDs are saying that endo is a womb disease. It's a period disease. And that's all it is. And that is so far from correct. So just to start off, it's a systemic inflammatory disease. It's full body. Even if you don't have it in your full body, because some women do. Some women have it on like multiple organs. But even for me, like such as myself with stage 1 endo contained in my pelvis, it still affects my entire body head to toe. Like I've already mentioned, like I do have these symptoms from menstruation and from ovulation. It's a very hormonally driven disease. And honestly, anything in a cycling body is hormonally driven. Or anything in any human body is hormonally driven. Like hormones make us who we are. And for a cycling woman or a cycling individual, literally any disease you have is going to be cyclical to some extent. Whether or not you realize it, it's probably just you haven't paid attention to it. And some more than others. Endometriosis, very endocrine related, creates its own hormones. It's a hormonally driven disease. And so it makes sense that our hormonal cycles affect it so deeply. And like, it's such cyclical, there's so many cyclical symptoms, right? That makes sense. And that is part of the reason people really get this misconception of like, oh, it's just a bad period. Because that's a pretty common symptom for a lot of us. And because of like socially how we view women's health and how we view women in general, calling them the weaker sex, which is actually the most psychotic thing I've ever heard in my life. Like, who gives birth? Okay, definitely the stronger sex. Like, I don't care. I don't care what we're talking about. The stronger sex is always going to be the sex that gives birth. And I'll go to the mat on that one. But like from a social standpoint, we view women as weaker. We think that women's issues aren't like actually real. We think that women are over dramatic or that they're crazy, that it's all in their head. We love to gaslight women. And the foundations of modern medicine are rooted in that. They're rooted in a bitches be crazy mentality. And if you're interested in learning more about how medicine has formed over the past couple centuries and how we've kind of ended up where we're at now, one of my favorite books ever that I know I've talked about on here multiple times is All in Her Head by Dr. Elizabeth Coleman. Absolutely recommend that book. But anyway, since modern medicine is very much rooted in that, we have these preconceived notions about the womb, about the uterus. Historically, we have always loved to blame, and by we, I mean like medicine. Like these are the people that we're supposed to be able to trust, right? And I'm not saying that we can't. I don't want to foster like complete just trust in the medical system, but as women, we need to be a lot more vigilant about what our doctors are saying and where the data is coming from, because more often than not, it's coming from male bodies, that data. And that's the data they're trained on. And we don't teach very much about the female body, and a lot of things, like I said, a lot of data is based on men and then sized down for women as if we're just tiny men. And we're not. We're completely biochemically, fundamentally different. And the things that apply to male bodies don't often apply to female bodies. So it's important to remember that. But medicine for millennia has truly, like, just loved to blame the womb for everything. We can date this back to the wandering womb, in ancient Greek philosophy and medicine. They literally believed that the uterus, if it wasn't fulfilling its duty of growing a child, it would wander around the body and cause all of these bad humors and stuff. Um, and one of the treatments for this, other than like pregnant, like it would be like, you need to have sex, you need to get married and have sex and have a baby was like the main treatment. There was also like, they would put like garlic at the mouth and honey at the vagina in order to like draw the womb back to its place. And like, obviously modern doctors aren't like, know that the womb isn't wandering around, but the mentality is exactly the same. Like, we really need to come to terms with that and fucking fix it, because the mentality is exactly the same in medicine today. Of let's just blame the uterus. Let's just blame femininity in general. And that's what's happening. And so with endometriosis, it's a poorly named disease. So let's start there. A lot of people were commenting like, why is it called endometriosis? Then it literally means like disease of the womb, blah, blah, blah. When endometriosis was first discovered, they thought it was endometrial tissue, which is a very biased conclusion, right? Because it reminded them of the endometrium. It has that same sticky quality. And they already, like I said, medical doctors already had this notion that like the womb is to be blamed for everything. So they said that it came from the womb, and that was the original thought process of like what endometriosis is. But we know now it's not. We know with modern technology that the cell type is not the same. They say that it's endometrial-like. I say, unless you're a research scientist, that's an unnecessary detail. It's a foreign tissue. It's sticky. It can glue your organs together. We don't need to equate it to the uterus or use the uterus as like a starting off point, because most people in their life haven't held uterine tissue in their hands, unless you're playing with your period blood. So what is the point? Like, why, if you are not a research scientist in the lab and that's like a necessary detail for you to know, then why are we saying it? We don't need to be equating endometriosis to the womb, to endometrial tissue, because it's not what it is. And again, I will sign any petition that says we need a complete rebrand for this disease, because the name is so misleading. And that is one of the main comments I've been getting is like, why is it called that? Because of misogyny. That's why it's called that. And outdated beliefs. So as I've said, of course it's cyclical. The symptoms are very cyclical, but it actually doesn't have anything to do with the uterus at all. Unless it is growing on your uterus, which it does. A lot of women, it does grow on their uterus. A lot of women, it doesn't. For me, for example, like my endometriosis is not on my uterus, hasn't touched my uterus, or my ovaries. Thankfully, I'm thankful for that. That doesn't mean that I don't have symptoms related to it, because like I said, full body inflammatory disease, the inflammation from this disease can affect any part of the body, whether or not tissue is actually present there. The other thing I want to address is imaging and diagnosis and who should be performing your surgery. And I might sound like a broken record if you've been listening to me for a while, but this is so, so, so important. There are very, very, very few qualified endometriosis specialists, endometriosis excision specialists. The gold standard treatment for endometriosis is excision. Ablation is not considered to be proper treatment. It often causes more inflammation for an already deeply inflammatory disease. I always describe it as lighting a fire on fire. It's not considered proper treatment. Excision is. And not just any excision, but excision with a endometriosis excision specialist, somebody who has gone through the extra training. But see, there's really no guidelines around this. From what I can tell, there's no formalized guidelines that you need to be able to call yourself that. A true endoexcision specialist has gone through like voluntary extra training that they're not getting compensated for, as far as I can tell. Not to mention gynecological surgeons get paid significantly less than other surgeons. And it's not a gynecological disease. But that's just how we have it classified at the moment. We also have it classified as benign, which is medically defined as doesn't invade surrounding tissue, which endometriosis does invade surrounding tissue. We know that. So its official classifications are wildly incorrect based on our modern knowledge. So that's already a really big hurdle for us in getting diagnosed. And then having an actual specialist do your surgery is so important, because even if you have a regular gynecologist who says, I'm going to do an excision, I won't do an ablation, it's like, okay, good, but you're still not trained. You still haven't been working specifically with endometriosis patients. You don't do a majority, like the majority of a true specialist's workday will be spent with endometriosis patients, doing excision surgeries on endometriosis patients. And they are highly trained to see the disease. So I always say, like, when they were showing me the pictures from my surgery, I was like, what are we looking at? It's like it was slightly yellowish. Like, endometriosis can show up in multiple different colors in multiple different ways. It's not always this like big chocolate cyst that's like super obvious and like bloody. Mine was literally yellow and like clear in these pictures. And so I was like, that's crazy. That this doctor was able to recognize that. And I guarantee you, if I was just went to a regular old gynecologist, they would have opened me up and like, looks fine. And then told me that I didn't have endo, that I was perfectly fine. And that would have been a lie, but they wouldn't have known any better. And so many women are experiencing that. So many women. And then on top of that, even before you get to the surgery point, you obviously do imaging first, and that makes sense. However, it's really, really important to remember when you get imaging done that endometriosis does not show up on the majority of scans. Most women who end up getting diagnosed are diagnosed through surgery because it is not very common for it to show up on a scan. Like, ultrasounds especially, super rare. There is like a special technique that some specialists use to see endo on ultrasounds. It's very rare. And also, it's just a regular old ultrasound that chances are is what your gynecologist or GP is going to order. You're not going to be able to see it. So it's important to know that, because doctors don't even know that. Some doctors don't even know that. And then even an MRI won't see, it definitely won't see superficial endometriosis like mine was, like not deeply infiltrated. And then it doesn't always see deeply infiltrated as far as I can tell, because I have had women commenting on my videos being like, yeah, we did multiple scans and, ultrasounds and MRIs, and nothing, they didn't see anything at all. But when they opened me up, it was like like stage 4, like my entire abdomen just covered in endo. They had to scrape it all out, despite quote unquote clear MRIs and clear ultrasounds. So yes, scans are a really important tool, especially before surgery, because if you do see it, if it does show up on an MRI, your surgeon can, and again, it's not going to show the full extent on an MRI necessarily. Like, even if some of it is seen, chances are it's not going to be all of it. But if it does show up on an MRI in an organ or a location that your surgeon isn't comfortable operating on, they can see that before surgery and be like, okay, I'm going to need a gastroenterologist in the room, or whatever. I'll need another type of surgeon in the room when we're doing this surgery. And that can prevent them kind of opening you up and being like, whoa, this is too complicated. We need other surgeons present. And then you having to get a second surgery scheduled, and the first one's basically pointless. Imaging is a very useful tool before surgery, especially for that reason. The problem is when I hear women say, my gynecologist ordered an ultrasound, they ordered an MRI, they didn't see anything, and so they told me I'm clear. There's no endo. And that's not true. That is not true. We cannot rely, these scans are not reliable. They're not reliable, they're not consistent, they do not always show endometriosis, and more often than not, they don't. And surgery is the only way to truly rule out endo. So unless you have had a surgery with a true endometriosis excision specialist, because like I said, other types of surgeons can miss the disease altogether. So unless you've had it with an actual specialist, you cannot rule out endometriosis. So even if you have doctors telling you like you don't have endo and they're basing that off of scans or surgeries with unqualified surgeons, you really can't take that at face value. And if you're someone listening who's like been searching for answers and who is in that situation, that might be like a relief to hear. Or if you were like really hoping that that endo would be ruled out and now you're being told like, oh, it might not be. I'm sorry. But anyway, that's the reality when it comes to diagnosis and scans. And that was the other thing that kept coming up um in my comment section where people were kind of saying this of like, oh, well, I don't have endo because I had an MRI. And it's like, yeah, but no. Um, that doesn't necessarily mean anything. So endometriosis, not endometrial tissue, also can only be ruled out via laparoscopic excision with an endometriosis excision specialist. The third myth I kind of want to bust here about endometriosis is the whole being cured thing, because there are also doctors out there saying some pretty crazy shit about curing endo. So let me just be like perfectly upfront and clear right now to start this off. Endometriosis is a chronic illness and we do not have a cure. I'm recording this in March of 2026 and we do not have a cure for endometriosis. Doesn't exist. As I've stated, gold standard treatment, excision with an endo excision specialist. And that can make a huge difference on somebody's life. And can provide a lot of relief, and I definitely recommend it. However, it's a treatment. It's not a cure. Endo can continue to grow anywhere it wants at any point. And we don't know too much about its behavior, why it does what it does. So, pregnancy, not a cure. And if you know me from TikTok, you know I've been doing the unprofessional opinion series, talking about like the craziest things that people are commenting that they've been told at the doctor's office. And some of these things are so truly messed up. And pregnancy comes up all the time. Like doctors are recommending pregnancy to children, to literal children. The youngest I've heard so far in my comment section is 8 years old. 8 years old. And then a lot of people in like the 14 to 17 range being recommended pregnancy. Teen pregnancy is literally the prescription from these doctors for endometriosis and for period pain and for heavy periods. This is what too many doctors, there should be 0 doctors recommending pregnancy as a cure for anything other than baby fever. Based on the amount of comments I get with that specific line of you should get pregnant to cure XYZ, there are way more doctors saying that than I think any of us ever could have realized. And that is something that a lot of women are saying is like, okay, I'm so glad that I'm not alone. I'm so glad I'm not the only person who's been told this. So I feel like it's common sense, but in case you needed to be told, pregnancy doesn't cure any disease, endometriosis included. It also doesn't make it better. I've heard people say that it's like a third. So like a third of the time it gets better, a third of the time it gets worse, and a third it just stays the same in terms of like symptoms. But based on my comment sections, pretty much all of the women commenting who are endo mamas are like, no, it got way, way worse after my pregnancy, after I gave birth. My endometriosis symptoms came back with a vengeance. So really doesn't cure anything. It's also really like insensitive because one of the most common symptoms of endo is infertility. And so it's like really fucked up to look at a patient who potentially is like struggling with getting pregnant and is really feeling the emotional weight of that, and then be like, cure your disease with pregnancy. And she's like, I fucking can't. And also it's just, I mean, it's fucked up for so many reasons. I feel like it doesn't need an explanation, but I don't know. The other thing, hysterectomies. Hysterectomies are often told to patients by a lot of gynecologists, get a hysterectomy, it'll cure your endometriosis. That is not true. Hysterectomies can be a really useful tool for managing symptoms depending on what your symptoms are, right? And where your endo is. If you do have like a lot of endometriosis on your uterus. Also, I'll say endometriosis tends to be comorbid with adenomyosis, which is inside the uterus, and that is the uterine tissue. It just grows deep into like the muscle in the uterus and can cause really heavy periods and pain and bloating and a lot of similar symptoms. But adenomyosis is different, and removing the uterus does effectively remove adenomyosis because it's in the uterus. Endometriosis is not. Like we've established, it's systemic, it's inflammatory, it's full body situation. So no matter how many organs you remove, As long as there is breath in your lungs, endometriosis could still grow. Will it? Like, we don't really have good predictors for that at the moment, but it can. So even if your endo was very much contained on your uterus and you remove it, it still can, it can grow. It can grow wherever. Endometriosis is not contingent on a period. It is not contingent on a womb. It's not contingent on anything other than breath in the lungs, like I said. So when women are told, like, this is truly heartbreaking to me because so many women are being told this, that like, yeah, you have endo, or it sounds like you have endo. I'm just going to take your uterus out and you'll be good to go. And then, like, they probably do experience it. Like I said, it's really good for symptom management for some women. So, like, you probably, like, you might experience all of this, like, relief and you're like, oh my God, I am cured. But then symptoms might start to come back, or like it, fixed your cramping situation, but you're still having all of this like bowel issues and pain when you go to the bathroom. And you're like, why isn't that fixed? Because you have endo in your bowels and like you can't remove your bowels. But the doctor didn't tell you that. And then you're finding out from a fucking TikTok, like from my bitch ass, that you don't act like that you aren't cured. And then you've been thinking that you're crazy all these years because your doctor told you that you were cured and that it was taken care of. And so you're like, oh fuck, like this must just be in my head because I can't possibly have this disease anymore. Or like, oh no, it must be something else. Like you go down all these other dead ends because you're trying to find a different explanation because your doctor told you it couldn't possibly be endo because they removed your uterus. That just doesn't make any sense. Because like I said, not a uterus disease, not a womb disease. And removing the uterus is not going to cure it. Point blank, period. And the fact that there are doctors out there spreading this lie is so fucked up. I understand there's an extreme amount of misinformation and that the way that they're being educated in medical school isn't correct. Like, if they talk about endometriosis at all, it's full of misinformation from what I've heard from people who have gone through medical school. They're like, yeah, we weren't taught this, or we were taught this, even though it's not true. And this goes for a lot of women's health. There's a lot of misinformation around PCOS as well, and like all this other stuff. So unless a doctor is actually like actively checking their bias and fighting back against the misogyny and doing their own research on top of their already very busy schedules, chances are they're not going to know any better. But here's the thing. If you're performing fucking surgery under a false pretense because you didn't do your goddamn research, that's negligence. And I truly think that you should have your license taken away. I really do. And in some situations, I've heard some horror stories where you should be in fucking jail. So we're coming up on the end here. Just to recap those like main myths that I really wanted to bust as we're beginning Endometriosis Awareness Month is that it's not a womb disease. It's not a bad period. The cells are not the same as the endometrial lining. They're different cells. 2, that endo cannot be ruled out without surgery with an endometriosis excision specialist. Other types of surgeons who aren't specialists might miss the disease altogether. So even if you got the all clear from a regular gynecologist, that doesn't actually mean necessarily that it's all clear. And then also scans, ultrasounds, MRIs can be really useful tools, but they also do not rule out endo. They cannot tell us with absolute certainty whether or not endo is present. And then 3, there's no cure. It's a chronic illness, and neither pregnancy nor hysterectomy nor birth control nor anything else can cure this disease as of right now, right? Fingers crossed. So thank you guys so much for listening. I hope this episode taught you something about endometriosis. And I know that I was well overdue for an update on my situation. So, hope you enjoyed that or found some comfort in it if it's something you're going through at the moment. I also want to let you guys know that I do have an affiliate link now for Warmies. I think I've mentioned Warmies on the pod before, but it's basically a stuffed animal that you stick in the microwave and warm it up. And it's like a little heating pad. And my mom got me one for Christmas a couple years ago. And I was like, this is adorable. And it stays warm for like a solid amount of time, like 30, 45 minutes. And so I just lay on the couch with it. And I don't have to be afraid about like falling asleep with it, because whenever I have a heating pad on, I'm always afraid I'm going to fall asleep with it plugged in and like set myself on fire. So I don't have to worry about that. And then it's a freaking adorable stuffed animal. It brings me so much comfort when I'm like dying. It's a heating pad that hugs you, and I have 3 of them now. So my mom got me one, then my boyfriend got me one. It's a dinosaur because I love dinosaurs, and then I just got a sloth, courtesy of Warmies. So if you're interested in trying them out, you can click the link below and get 15% off your first order. Thank you guys so much for listening. Feel free to send me emails with questions or feedback or anything. You can email me, autumn@thehealthclassshedeserves.com, TikTok and Instagram in the show notes. Reach out to me there. I love hearing from you guys. And stay tuned for more endometriosis content coming your way this month. Class dismissed.